We welcome you to our module Neoplasms, HCCs 8, 10 and 12 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of neoplasms, including metastatic cancer, acute leukemia, lymphoma, tumors, breast, prostate and other cancers. At the end of this module, the learner will be able to define malignant neoplasms and distinguish between solid and liquid tumors. Differentiate between the criteria for the documentation of neoplasms for patients with active cancer and a history of cancer. Identify the ICD-10 codes that fall under neoplasms. Review the example of the assessment and plan for the patients with active cancer and a history of cancer. Tumors, or neoplasms, are a group of abnormal cells that cluster together to form a lump. They are formed when the cells divide and grow uncontrollably. They are classified as either benign or malignant. The term malignant neoplasm indicates that a tumor is cancerous. If not treated, malignant neoplasms invade healthy tissues and metastasize from the point of inception to other parts of the body, where they interfere with the functions of the body and become fatal. For codification purpose, they can be divided into two broad categories of solid tumors and liquid tumors. Solid tumors grow in situ in remote sites, for example neoplasms of colon and lung, breast cancer and metastasized tumors. Liquid tumors, on the other hand, are the tumors which have no single location and can develop from multiple sites, for example in case of multiple myeloma and leukemia where the cancer cells circulate in the blood or lymphatic system, a systemic cancer with no secondary sites. In order to be coded, cancers must have specific information included in the documentation, including whether it is primary or metastatic. The criterion depends on whether the patient is suffering from cancer or he or she has had a past history of cancer. For active cancer, there are several conditions. First, whether the patient is on current active treatment for curing or palliating symptoms of cancer. Second, if the cancer is unresponsive to treatment, and lastly, if the patient refuses treatment. When the patient is on current active treatment for cancer, and if SERM is being administered, indicate whether the medication is treatment for active cancer, or prophylaxis against the cancer's return. When the condition is current, in remission, there is a decrease of signs and symptoms of cancer. Note that the cancer may still be present in the body. In remission is coded as current as long as there is no contradictory information elsewhere in the record, i.e. breast CA surgery 2 years ago. Lymphoma patients who are in remission are considered to have evidence of disease and should be assigned the appropriate code. For patients who have already been treated for cancer and is with no active disease, NAD, at an organ level, not a cellular level, for coding guidelines. This means the patient has a negative biopsy and no palliative or curative treatment is documented in the patient's record. Once the cancer is treated and excised, it becomes a history of. Patient's visitations to the specialist with NAD is coded as a history of cancer with the follow codes of the healed condition. If the condition is found to have recurred during the specialist's visitations, then the code for the condition will be coded as an active cancer, replacing the history of cancer. Let us look at the ICD codes for malignant neoplasm. For malignant neoplasm of colon, which is unspecified in nature, the code is C18.9, HCC 11. For malignant neoplasm of unspecified part of unspecified bronchus or lung, the code is C34.90, HCC 9. For malignant neoplasm of unspecified site of unspecified female breast, the ICD code is C50.919, HCC 12. For malignant neoplasm of prostate, the code is C61, and the HCC value is 12. For unspecified Hodgkin lymphoma on unspecified site, the code is C81.90, HCC 10. For unspecified non-Hodgkin lymphoma on unspecified site, the code is C85.90, and the HCC is 10. And lastly, for acute leukemia of unspecified cell type, in remission, the code is C95.01, HCC 8. The assessment and plan differs for patients with a history of cancer, and those who currently diagnosed with the disease. Let's look at the progress report for an active cancer patient with different forms of cancer. Example 1. Patient name, Alexandria Hernandez. Date of service, February 27, 2019. Date of birth, October 11, 1970. Assessment and plan. Example 1. Patient has primary breast cancer. Status post-chemo/radiation/surgery is now on tamoxifen for 5 years. The patient is on treatment and no other statement where the patient states are with NAD. Example 2. Patient diagnosed with primary colon cancer status post-surgery, currently being treated with fluorouracil and CyberKnife. Example 3. Patient diagnosed with metastatic lung cancer, primary site unknown waiting for surgery. Example 4. Hodgkin's lymphoma in remission. Last recurrence was in 2018. Normal labs. Monitor with specialist oncologist. Example 5. Adenocarcinoma colon cancer with positive colonoscopy, pathologist report on August 10, 2018, patient refuses to see oncologist and treatment. She states, "I prefer to live in peace for the time I have left. Will monitor." Palliative treatment as to comfort patient. For a patient with a history of cancer. Patient name: Alexandria Hernandez. Date of service: February 27, 2019. Date of birth: October 11, 1970. Assessment and plan. Example 1. History of primary colon cancer, status post-surgery 2015, follow-up with the oncologist. Biopsy shows NAD. Colonoscopy next month. Example 2. History of prostate cancer, surgery 2018, with normal PSA and follow-up by the oncologist. We will continue to monitor PSA. Normal labs. Follow-up in 6 months. Example 3. History of primary breast, left, adenocarcinoma with BRCA test positive. Status post-surgery/chemo/radiation, left surgery, in 2014. Left implant present and no concerns. Negative physical examination. Last mammogram 2018 negative. Strong family history of breast cancer will continue to monitor with oncologist. To know more about the BRCA test, click here. BRCA test is offered to patients who are likely to have inherent mutation based on personal and family history. The patient is with an increased risk for cancer but there is NAD and no active treatment to the site. We have reached the end of our short refresher course on neoplasms. We gave you a short introduction to the disease, reviewed the criteria for the documentation, identified the specific codes and HCC categories pertaining to them and finally discussed the assessment and plan for the diagnosis. Thank you for joining us.